All right, my name is Lisa Fury. I'm a parent of a 12-year-old, Gavin, who's interstitial. And I'd like to introduce the next two speakers, Dr. Kathleen Farrell, who coordinates and manages the Epilepsy Foundation's participation in the Rare Epilepsy Network, and Allison Kukla, who leads the Community Engagement Core, which is part of the Epilepsy Learning Healthcare System Initiative. So they'll be talking about the Epilepsy Learning Healthcare System.
Good morning, everyone. My name is Dr. Kathleen Farrell. I'm the Senior Director of Clinical Research at the Epilepsy Foundation National Office, and I'm pleased to be here today. Thank you so much for including me in this wonderful conference. I'm presenting with Allison Kukla, my colleague, about the Epilepsy Learning Healthcare System. You'll also maybe hear us refer to it as the ELHS or ELIS. Let's make sure. Next slide. There we go. So we know that there's an unmet need for people living with epilepsy, be it rare epilepsy or more garden variety. People may experience years of delay in their diagnosis. They can go through years of a trial and error approach in their treatment, dozens of medications, and some people may never find a medication or treatment option that adequately controls their seizures. People may miss opportunities to be considered for a curative surgery, an epilepsy treatment device, or a dietary therapy. People, women particularly with epilepsy, obviously can become pregnant when they didn't intend to because they might not be aware of the interaction of their birth control with their anti-epileptic medications. Often we see that people with epilepsy are not aware that they're at an increased risk of premature death or SUDEP, sudden unexpected death in epilepsy, because their provider may not have mentioned it to them that they're at risk. So we know that our system of epilepsy care is broken. We have to do better for people living with epilepsy. And you'll see here in the graph in front of you that over the last 30 years, we've developed almost as many new medications for epilepsy, and yet we haven't moved that needle for people. There still remains 30% of people living with epilepsy won't reach adequate seizure control, and that's not acceptable. Here you'll see the Epilepsy Learning Healthcare System, or ELIS, system level framework. This graph comes from the Institute of Medicine report a few years back, showing the ideal state of a multi-stakeholder system of care. The ELIS is creating an evidence-based infrastructure to collect data on what works for people in treatment and why it works. It allows for dissemination of results in a time frame that matters. The ELIS is set up in a hub and spoke model. The Epilepsy Foundation is serving as the hub and is made up of multiple components: a community engagement component, which Allison will be speaking about shortly, a clinical arm, a quality improvement or QI arm, data and community services. And each clinical site that joins the network has those same components at their local level on their local improvement team. This system and infrastructure allows for constant learning and sharing, reflecting on results and taking action based on what is seen in clinic. So the ELIS vision was designed with multi-stakeholder input. We realized, based on the voices of including Vanessa and other rare epilepsy advocates, that we needed to include the people who might not necessarily reach seizure control. So the way that we designed our vision is that all people with epilepsy will be able to live with their highest quality of life, striving for freedom from seizures and side effects, and that we won't stop until we get there. Recognizing the spectrum of epilepsy severity and diagnosis and the reasons why people have seizures varies so greatly. So the ELIS is a movement to transform care so that it's centered on people with epilepsy and their families and their goals. That it's easy for providers to consistently provide treatment based on best practices, and that we're continually turning research into care in a time frame that matters and solutions in a time frame that matters. So who are we? The Epilepsy Learning Healthcare System is, again, made up of all stakeholder voices, and no one voice is more important or, prioritized above the other. We are people with epilepsy, family members and caregivers, healthcare providers, community advocates, researchers, and clinicians. And this structure, and Allison again is going to expand on this a little bit more, this is an overview of our network structure, showing the way that the data center, a community engagement core, clinical core, quality improvement or QI core, and community services work together to do what we've just spoken about. So we were funded initially about a year and a half ago through a PCORI grant, the Patient-Centered Outcomes Research Institute. And that funding came through Cincinnati Children's Hospital, Anderson Center for Health Systems Excellence. And over the last year and a half, we've been designing, like I said, the infrastructure that I spoke about. And we've begun building our teams both on the community side and the clinical side. So to date, we have about 15 sites that have been working with us and are exploring membership, and currently reached our 6th confirmed site. So we're well on our way to reaching our goal that we've set for by the end of this year, having 10 participating clinical centers. And the centers are both in the adult care realm and the pediatric care realm. So Barron Neurologic Institute in Arizona, Children's Hospital of Atlanta in Georgia, Partners Health, which is made up of Massachusetts General and Brigham Women's in Massachusetts, Beth Israel Lahey Health in Massachusetts, the Children's Hospital of Philadelphia in Pennsylvania, and Penn State Hershey Children's Hospital in Pennsylvania are all confirmed sites. The other sites that you see listed, and this is just a short list of them, include hospitals in California, North Carolina, New York, Ohio, and Texas. UT Texas Health is one of the sites that is currently exploring partnership. So there's others on our radar. Allison is going to talk a little bit more about the role that you have in advocating for the sites that you or your loved one attend for becoming a part of a network like this. So I will turn it over to Allison Kukla, who will be discussing about the Community Engagement Core. Thank you.
It's the top one, yeah.
Thank you. Thank you, Kathleen. So the Community Engagement Core, as you saw in that larger picture, is one of the components of the ELHS. So who are we? What do we do? The Community Engagement Core is a critical part of the ELHS. It's a group of people living with epilepsy, such as myself, families, caregivers, advocates, that come together and provide feedback and their priorities of what's important to them as we were building and continue to grow the ELHS. Our priorities that have been derived that we're focusing on, such as seizure documentation, quality of life, which I've heard a few speakers touch upon, are some of the priorities that really rose to the top when we were talking with this group on what do we need to focus on. So we have the shared vision with the overall ELHS, but some parents and I came together and were talking about, what do we want the CEC mission to be? The major component is co-production. So you saw all the folks that Kathleen listed that are a part of the ELHS. So it's all of us producing together. The Community Engagement Core, we have a seat at the table. We, are just as involved as the researchers, the clinicians, and all of that to share our voice, our experience about, what we need, what health outcomes we want to improve for ourselves and for our children. And some of those, as I mentioned, are the quality of life, improving seizure control, and improving seizure freedom. So our CEC members, we have about 35 members right now. It consists of some of the organizations listed here. Do15Q, one of our major champions. Vanessa is actively involved in the group and is one of those go-to partners that I can reach out to and be like, hey, we need some quick feedback. Like, what do you think? Which we really appreciate. I really appreciate. Because we want to hear, as Kathleen said, from all of the different epilepsies, the rare epilepsies, people, and all of that. So it's a broad spectrum that we're covering. It also includes local and national Epilepsy Foundation staff, but then also advocates that aren't connected to an organization or a center or anything, but are just passionate about this work. That is how I started on this project. I was just, as I said, a person with epilepsy, engaged and wanting to do more, and have gotten to lead this amazing group of people. So we have quarterly calls where we all just kind of catch up on what's going on. And then we have twice a year learning sessions where we meet in person and just update the group, talk about the work that we've been doing, the work that we're going to start doing again. So there's a lot of engagement opportunities for our community engagement core members. You can see a list up there. I won't read it all to you. But the main point is, folks are volunteering their time to be a part of this effort. So however much time you want to give or however little, we'll take it. And I know, as I've seen all the different committees that the Alliance has, it's very similar. We have different work groups that you can be involved in on, quality of life for both peds and adults, seizure documentation, comorbidities. There's a whole range of the different priority areas that we're looking to focus on. And then some of the current work that we're doing, as you saw the list of centers that Kathleen listed, we're writing letters to encourage participation from either the organization's point of view, a patient, a family. We have templates right up there. There's a picture. Vanessa helped, kind of beef up and, make the language a bit more powerful on encouraging participation. We've had success with this letter. We had 2 parents whose children seek care at Children's Hospital of Philadelphia write letters, send them along to the epileptologist team and neurology team, and they're a current center. So this is one way, that we're trying to get the word out, educate, and really hearing from the patient family about why this is important. If you didn't see your center on that list, where I currently seek care is not on that list, and it's why? I want you on that list. If I'm getting if you're a top center, I want to hear why you need to get involved and why you should be, on this movement with us. We also are working to identify patient-family partners, which is the PFP there, at the local sites. So each of the sites that are involved, they create their own local site team. And we require them to identify patient-family partners to be on their team to hear from them directly as they're doing their work at their local site. So we are actively trying to find these folks for the sites that are involved that can be a part and, give that patient-parent perspective. And then we're also, we create change packages around our priority areas. So we're currently working on treatment adherence and, what barriers are there to treatment adherence that people with epilepsy and, families face if it's taking medications or, I don't have to tell this group, treatment medication can be challenging sometimes. So we're working on that right now in one of our working groups to figure out, the evidence-based ways and the best ways that we can encourage and improve treatment adherence for people within the community. So we just want to thank you for letting us come and speak with you today. If you're interested and want to get involved, you can shoot us an email and we'll connect you with the right folks. And then I think we also have time for questions, if anyone would like to ask us any questions on the spot. And if not, thank you guys again very much for having us here. It's both of our first conference coming to join you all, so